I'm Margaret Josephs, and I've happily been on GLP-1s for the last 3.5 years. And I'm going to answer your most common questions you have about GLP-1s. So what is a GLP-1? A GLP-1 actually is something that is already in your body, but sometimes we don't listen to those signals. So this is just a little helper, a boost to let you know when you are full and you don't really need to eat anymore. That food noise. Is it just for diabetes or is it also for weight loss? Okay. Actually, it started for diabetes, but now doctors actually use it for safe weight loss. What results do people see? Okay, studies show that you could lose a significant amount of weight, but you should also healthy lifestyle habits. What are the side effects? Some people say you could feel nauseous at first. I was very blessed that I didn't feel any nausea, but it definitely subsides as your body gets to it. What happens if you stop? Like with any tool, some results can fade. But that's why working with the right provider, like LifeRx, is very beneficial. You can go on a maintenance dose and just keep incorporating your healthy lifestyle. So let me show you the behind the scenes at the lab, and I'm going to introduce you to Phil, the pharmacist.
Phil, how does a GLP-1 affect your appetite and blood sugar? Let's give them the science behind it.
So insulin is a natural occurring hormone in your body that controls the sugar levels all around you. When insulin is secreted, your body takes in sugar. GLP-1s work on glucagon, which is the reverse of what insulin does. So it inhibits insulin's action by promoting glucagon in the body, which tells your body you're fed and to stop eating.
A lot of people have been asking me, is a GLP-1 the same as insulin?
No, it's not. GLP works on a completely separate pathway in your body to regulate the sugar.
Okay, great. Phil, how are GLP-1s actually so successful and different than other weight loss management drugs?
Well, this is a different approach to weight loss. A lot of other drugs are stimulants working in the brain to reduce the amount of cravings you have. GLP-1s works on the internal pathways of your body. It stops hormones from being secreted so that your body does not get the signal to eat more food.
Yeah, it works naturally.
It's a natural agent, which is why I can say this is a blockbuster drug.
You know what, Phil? Originally, this was a drug approved for diabetes. It was a diabetes drug. How did this happen that it got approved for weight loss?
Well, it was effective at reducing your sugar. However, the side effect is by regulating your sugar to such an extent, you start to lose weight. And as people reported, and this drug's been out for quite some time, as people reported successful results losing weight, the drug manufacturers and the public has realized this is a very potent agent for weight loss.
How does the patient know that this is going to be safe for them and healthy for them?
Well, every patient has a telemed visit with one of our physicians. Our physicians qualify the patients and check their BMI, check their blood, and do a general consult to see where they are for the medication. Once they've done that qualification process, the prescription is sent to the pharmacy. And this is where the magic happens. This is where the prescriptions are made, custom, tailored for your benefit.
Phil, thank you so much. You were so insightful, so helpful. I love knowing
You're
everything.
absolutely welcome.
Thank you. Okay, you saw the behind the scenes, all the secrets behind the GLP-1s. I hope you're impressed as much as I am. It's unbelievable. So I'm just going to tell you my personal story with GLP-1s. When I first started on them, they were called peptides. And I was told it's naturally occurring in your body. And it is. And it worked wonders. I felt like this is a miracle. And I have felt fantastic on it. My A1C is down. My numbers have never been better. My cholesterol is down. And I've lost the desired weight that I wanted to, 22 pounds, 22, 23 pounds. And everyone's like, Marge, why don't you go off it? Why would I give up something so good and so healthy? I said, I'm not going to do that, but I'm on a maintenance dose. And that's what it is. My doctor said, stay on the maintenance dose because your numbers are so good. If you're curious about GLP-1s, talk to the experts. That's why I partner with LifeRx. You're working with amazing physicians